My name is Kenna Volkman, and today I'm going to convince you why physician-assisted suicide should be legal. Now, the main argument to look at here is why patients can refuse treatment and die as a consequence, but they can't accept treatment and die as a consequence. It makes no sense. Now, clearly, if a person wants to find a way to kill themselves, they can find a way to get the job done. And it's unfortunate, but it's true. There are so many different ways a person can kill themselves today. And personally, I don't see any harm in making it less easy for them to do so. Because I believe that everyone should die in peace and at rest and with their dignity intact. I believe everyone deserves to die peacefully and not suffering and in pain. Now, for some of you who may not know, physician-assisted suicide is obviously when a physician assists in the killing of their patient. But what most people make the mistake of is thinking that the physician actually kills the patient, and that is wrong. The physician actually does less than you might think. All the physician does is supply the substance or narcotic used to carry out this whole process. Most of the time, the physician will fill a syringe with a narcotic, usually morphine, and accidentally leave it in the patient's room, and then the patient will take the syringe, inject themselves, and eventually they will die. And that is how physician-assisted suicide is carried out. But the important thing to remember here is that the patient is choosing to die. The patient wants to die, and they are making the choice. It is not the physician making the choice for the patient that they need to die. It is the patient. So I think that less strain needs to be put on the physician, because if anything, they are just trying to fulfill their patient's wishes. And actually, I think that's very admirable about a physician. Now, the only difference I see between physician-assisted suicide and just committing suicide is how readily available the resources are. With a physician-assisted suicide, obviously there's a physician involved, so the physician is going to have full access to these narcotics, while just your regular average Joe is not going to have, full access to morphine and drugs like that. But nowadays, with society, it's not that hard to get your hands on narcotics outside of the pharmacy as it used to be. It might take a little longer, but eventually your average Joe could get his hands on a narcotic if he so desired. And so that's really the main difference that I see. Now, according to the National Library of Medicine, approximately one physician-assisted suicide occurs every day in the world. Usually behind closed doors, of course, and not out in the news, but it's still happening. Physician-assisted suicide is still happening, even though it's illegal in a lot of places. And so that's an important thing to realize. Now, it is legal in 2 states in the United States, and that is Oregon and Washington. Now, I think that it should be legal, of course, in all 50 states. But there are 3 main reasons why I believe physician-assisted suicide should become legalized, and why it is not. But I think these 3 are the main reasons why it should become legal here. And the main one, and I think the best one, is that patients will have to endure, less suffering and endure less pain. And so I think that's a really good one. Also, it's their own right. It's their body. I believe they should have the right to decide when they want their body to go. And lastly, because believe it or not, physician-assisted suicide actually can save lives. And I will talk about that a little later. But for one, patients have to endure less pain and less suffering with physician-assisted suicide rather than just committing suicide or just dying and, ending their last few days just staying in that constant pain and agony. They're finally dying, getting to rest at peace. And like I said earlier, I believe everyone deserves to die at peace, in rest and with their dignity intact. Take a cancer patient, for example. Say they've been diagnosed a year ago with cancer, and in the last 8 months they've been in constant pain and agony. Are they going, do they want to continue their life in this, the little time that they do have left, just living in the pain that they are in, and maybe even getting in worse pain? Or do they want to be finally at peace and finally at ease? So I think that's a main point to look at here. Now, for my second reason, which is that I believe when a person wants to die, it should be their own personal choice, guaranteed by their individual freedoms. I think it should be everyone's personal choice. I don't think that anyone should have the right to decide for you, when you need to go and when you need to die. I think it should be an individual choice. Now on to my third reason, which some of you may not know, is that vital organs can actually be saved with physician-assisted suicide, whereas with committed suicide, the organs most of the time cannot be saved. And WebMD actually said that less than 10% of the times the organs can be saved when a person just commits suicide versus when it is a physician-assisted suicide. Now, before I conclude, let's look at the Declaration of Independence, which states that all men are created equal, that they are endowed by their Creator with certain inalienable rights, and among these are life, liberty, and the pursuit of happiness. Now, who are we to force people to live in agony, to rebuke their liberty, or to refuse the life to others who actually have a fighting chance?